6:50, we've all seen it happen. A coworker or friend coming back from a holiday vacation looking really refreshed. Well, this while you're still trying to get the tree down. Could it be they treated themselves to a little more than self-tanner? Dr. Mark Solomon is back. Good morning to you.
Good morning.
So the secret could be in the syringe. What's this new Artefill that you have?
Artefill is an almost permanent filler, unlike the other fillers that are presently on the market and have been for a number of years. Artefill can create up to 5 years of change with 1 or 2 injections. So it's a very different concept than the other fillers that go away after several months.
We're looking at the pictures. Clearly this is a guy. We see the before and after, and you've given me a lot of before and after pictures with injectables. I can say this is the biggest result I've been able to see with my non-doctor eyes.
That's correct, and this is more than 1 syringe, but nevertheless, it's an office treatment, it's relatively painless, and it's quick.
Okay, so the thing everyone in the newsroom is talking about is this mommy makeover. First of all, what is it?
The mommy makeover is sort of a combination of procedures to combat the ill of pregnancy, if you were. Not that pregnancy is an ill, but it creates a lot of changes that a lot of women don't like. Among those changes are changes in their breasts, changes in their abdomen, and even changes in other parts that we can't necessarily talk about.
Okay, and I know that you gave us pictures of a breast, but this is actually the tummy. Do you do the breasts and the tummy during the same surgical time?
That's correct. In fact, one of the nice things about this technique is oftentimes we can put breast implants in, for example, through the tummy, so there are no incisions on the breast.
Oh. And what did you do here in the before and after picture we just saw?
That was a woman who had a tummy tuck and a breast procedure, and obviously we didn't show her breasts, but I was able to do both procedures at one time, and she basically got her correction of her breasts that were sagging and her loose tummy skin and loose muscle.
And you're seeing this, we're told, a lot of times in women over 40 years old, they want to feel sexy again. Is that the typical kind of like sexy soccer mom client that you're getting? I don't know.
Well, it's the woman who's had her children and is ready to go back to being what she was before physically, but isn't able to get there through diet and exercise. Her skin won't respond. Her muscles might have been stretched. Women who have twin pregnancies, for example, oftentimes can't do anything to get their abdomen to look the way it used to. And if they breastfed at the same time, then everything's sort of heading toward the floor.
Okay, so this morning you're going to be with us and you're going to be taking questions. What kinds of things can you answer? What kinds of things can't you answer this morning to our viewers?
Well, I can certainly answer the most common questions people ask are, what does liposuction do as opposed to what does a tummy tuck do? And each of these procedures can play a role. Do I need a breast lift? Do I need breast implants? Can I get both? Those are all kinds of things that are easily addressed through question and answer, and quite possibly with a physical exam somebody wants to ultimately end up in an office being seen by a plastic surgeon.
And I know that when I talked with one of your nurses yesterday, she said a lot of people are still trying to figure out what in the world Botox is. It's something you use in your practice, and you say it can have great results.
Botox is terrific. What it does is something that no other product does. It weakens muscles. And since a lot of the smile lines that we get are from overactive muscles, you can weaken those muscles and get rid of the fine lines around the eyes and around the forehead, for example.
All right, Dr. Mark Solomon, you're going to be hanging out with us all morning long. Go to MedBoxPhilly.com, click on Good Day, and go to the Ask the Expert icon. Ask him your questions, don't be embarrassed, and we're going to read some of them, the less embarrassing ones, on the air throughout the show. Thank you, Doc. We'll see you in a little bit.
Thank you.